My name is William Christopher Lyons, although I go by Chris. I am from Shelbyville, Kentucky. I'm a graduate student at Kentucky State University, getting my master's degree in environmental studies. My history here started when I was a child. I actually had childhood cancer. March 19th of 2019 came, and I had flu-like symptoms. So I went to my primary care doctor, and they decided to run some blood work. And upon getting the results of the blood work, before we even got home, I got a phone call from the hospital saying, your hemoglobin is like 3.6, and you need to get to the ER. Dr. Badgett came in at 9 o'clock into my room after his daughter's dance recital, and gave me the news that I had acute myeloid leukemia. So the next day we started chemotherapy treatments, and I did 3 rounds here at University of Kentucky.
Chris had previously been a patient of ours when he was younger, and then he returned when he had a new diagnosis of AML, specifically monosomy 7 AML, and began his treatment here. Treatment for AML is intensive. It requires a lot of hospitalization, and it's a tough disease. So the treatment is accordingly pretty difficult to endure.
Every day that I took care of Chris, with very few exceptions, he was dressed, he was ready to go. He had picked out shirts that had buttons that would allow us to access his port, but he also then, walking down the hall, just looked like a professional.
So mostly when I was here at University of Kentucky, my doctors were very lenient, and they would often turn their blind eye and let me go for walks around University of Kentucky campus. At that point, I just had my father bring my camera up here for me, and so I just started taking pictures of architecture, maybe some weird colored fire hydrants, just anything. So I just started taking all these photos, had a whole collection of photos I took here at University of Kentucky from all my admissions here, my 3 rounds.
So Chris had this idea of photography, and he took some slightly unauthorized little jaunts around campus, but he was able to go around and look at things in a different way, explain to us how it got him through.
We were sort of aware that their walks might have extended beyond the boundaries of what we might normally find accessible. And so when Chris and his mom would go out, you know, there are therapeutic reasons why you have to get out of your room. And you know, he physically needed to use his body and get some exercise. So I think there was a lot of pretending not to know.
I was discussing with my nurse, Joey Burke, upstairs, about an idea I had about having a patient art gallery installed.
So when the idea from that meeting in front of the elevator sort of happened, and Chris and his mom and I were talking about art in the hospital, and Chris presented the idea, you know, why are there not more exhibits featuring patients? It just seemed to naturally come out of that conversation, and I think Mom said, there's a blank wall right there.
There's a fantastic caregiver named Joey Burke, and we've worked together on a couple other art projects. And she just called me up one day. She said, I've got this patient who I think is really amazing, and he's been doing this photography. And I was struck, so you know, I said, well, this sounds fantastic. Let me come up and meet him. And my colleague and I went up to his room, visited with him, and were just immediately taken by how emotionally intelligent he was and how wise he was for his age.
And he came up to my room one day and kind of talked to me about it. I said, I would like a patient gallery. I would like for it to be other patients' artwork. I'd like for them to have the opportunity to get displayed on the wall.
He wasn't bringing us up there because he wanted to see his work pasted all over the walls. He just wanted to share his experience because he thought, hey, I want to see how we can do this for all patients, to see if what I've done could be replicated, you know, with other patients on the wing. so that they can get sort of the same healing and the same benefit that I got from engaging in the arts while I was going through this illness.
Himself, he's a unique individual that he was looking how this could help other people, and if sharing his idea and his experiences was going to help someone else or develop a program where we could honor other patients, that's what he really wanted, not to reflect on himself but to help others in the future, which speaks of his character.
When these things actually started coming together and we knew that, yeah, this gallery exhibit was not just a, oh, wouldn't that be nice moment. It was a, yes, this really is going to happen. And you knew, yes, this is exactly the way it should be.
Yeah, one of the main things that kind of stuck out to me about the clinic was just the availability resources up there with the caregiver, social worker. She helped me with some emotional stuff when I was first diagnosed. And then Courtney Emery up there, the education coordinator, she was able to actually work with my university, because I had, when I was diagnosed, was right in the middle of my semester. So she was able to work with my university and get them to let me finish that semester while I was in the hospital. I know most hospitals, they probably wouldn't have a education coordinator that would be able to do that.
Amazingly, when most people are dropping out of life and not doing things, Chris worked with our school intervention specialist and was able to finish his coursework with a 4.0, which is unheard of.
Everyone up there is very attentive, and if I have any concerns, they always will address those concerns before they do a procedure or any kind of test. They'll address those concerns, make sure I don't have any questions, and they're awesome up there. They know what they're doing and definitely feel comfortable.
Because of the circumstances he was in, as he would go out on his photo shoots, he started noticing the beauty in the everyday. So many of us don't take notice of those things. And so when you have a situation like what Chris was in, it put him in that mindset to notice that, hey, that crumbling brick has a beautiful patina and color to it. That weird little reflection in the puddle is actually beautiful. And so what's striking is that, you know, through his struggle, he got put in that frame of mind, the way he's thinking about the composition and the way he's looking at the world through his own unique lens. Because that's sort of the beauty of photography at all times, right? Is whoever's operating that lens, we're seeing how they see the world.